Good evening, everyone. Happy Labor Day to all the Americas. It's a wonderful day today, and we had a holiday, but it was full of rain. So hopefully tomorrow we have less showers of rain. Welcome to a special edition of Health Tips with Avril this evening. I'm doing this special live with Stanislaus today, and I hope that she can share with us what she does as a sports therapist. Welcome if you're joining us for the first time. I can see we have two persons on here. Welcome wherever you are. Hi, Eva.
Hi, everyone. Good evening. Good evening, everyone.
Can you hear me, Nelly?
I can hear you loud and clear. Can you hear me?
Yes, I think everyone can hear you right now. All right. So welcome to Health Tips with Avril for the second time. You are our honored guest, and hopefully that we could do so much this evening. It is a pleasure to have you. Thank you for taking your time to share with us a few things of what you've done over the years since you graduated as a sports therapist. So Eva, tell us a little bit about who you are, where you went to school, what you have been doing over the past years since you graduated.
Okay, so let's see here. As far as I can remember, I attended the Cameron Memorial School, after which St. Joseph's Convent,
Yes.
South Louis, studied hospitality. And when I went to university, I studied sports therapy and I did a few postgrad courses in rehabilitation as well.
Awesome.
So I'm a sports therapy and rehabilitation specialist by occupation. I'm also a table tennis coach, a youth mentor, and in my spare time, I love assisting the elderly. So that's me in a nutshell.
Awesome. Amazing. Amazing. It is a pleasure to have you once again. And I know for sure some people will be saying, what do you do as a profession? Can you tell us what does a sports therapist does? And I know you said it probably different from a physiotherapist. So maybe you can tell us the difference. You can tell us a little bit about both, depending on what you want to say.
Okay, so as it pertains to sports therapy, my specialty would be manual therapy. So I do quite a bit of massages. In addition to this, you would have heard me mention earlier that I'm a table tennis coach. So I tend to mix it quite a bit. Try my hands at, all the different sports there is. So at least I could have an idea when the athletes come in so that I could treat them. But I specialize in manual therapy and I also do a bit of coaching as well.
Amazing. So tell us a little bit about manual therapy. And I know you said you probably would have to go, well, as a coach, tell us a little bit what manual therapy is. What do you
Okay.
see?
So it all
And
depends on what the person wants, the client that is, also what it is they're experiencing. So you could come in and you could just you've been, you're tired, you've had a hectic day and you just want a Swedish massage. So I'd give you that. You could also come in and, say to me that you're experiencing a bit of pain and discomfort in your shoulder. So I do quite a bit of assessment. Once it is I'm able to handle it, sometimes, it's a case whereby it might be related to stress. So you don't need an x-ray per se. So I could advise that, you put a cold compress on it. If it's something that's been there for a while, quite a bit of time, then I'll tell you, you could use a warm compress. Also, could do some deep tissue work, deep tissue techniques. So, if there's any tension, I could help relieve it as well. Also, I could prescribe for you exercises which you can do to help alleviate the pain if it's something that's persistent. So things of that nature. Sometimes
Worries
persons
that
may
you
come
would,
or
sorry, we
anything.
got cut off there. I think the internet a little bit break up a little bit. So can you
Can you
just
hear me?
yeah, I could hear you. Just repeat a little bit of what you said so our audience can hear you.
Okay, so when I was saying, it all depends as to what it is you're experiencing. If it is you an injury with your shoulder, it depends as to how severe it is. Sometimes I'd advise us to compress. If, let's say, for instance, it's stress related, then I could provide some manual therapy if there's any tension there.
Mm-hmm.
Let's say you sprain your ankle. So if it's something that happened and you're playing a sport, then I will strap it up for you, tape it. If it is we're on the pitch. If it is you come to my clinic, then it's a case whereby I'd assess it, then I'd give you ice if needs be, bandage it, advise us to aftercare. If it's something that's worrisome, I'd advise that you go for further care, get an X-ray. So
Awesome.
it all yeah.
It all depends. Okay. So for somebody like me who is sitting at a desk,
Mm-hmm.
free to maybe even 8 hours a day, what would you suggest for somebody who has lower back pain and always at a desk for 5 to 8 hours? What is your recommendation of me or anyone who is suffering with that pain?
Okay, so first and foremost, I would advise that you have a look as to what chair it is you're sitting on. Is it comfortable? Also,
Mhm.
your posture. Is it a case whereby you're slouching? Is it a
Yeah.
case whereby you're sitting on your waist? Also, sometimes you might need an extra bit of support, like a memory foam cushion or something of that nature.
Mm-hmm.
You know, if it's pain that's persistent, then on evenings, then you can actually put a compress that would actually help, a warm compress, anything of the sort. Yeah. And
Amazing.
take, so don't go like, 5 hours straight. Take a break, walk around, stretch it. Yeah. So that's what I would advise.
Awesome. Amazing. Because sometimes, as an office clerk or somebody who is in the office all day, sometimes they sit at the desk like for about maybe even 5 hours without even getting up to stretch or walk around or take a break. I'm happy that you said that we should take a break. Sometimes we don't remember to take a break. And at the end of the day, we have knee pain, we have back pain, we have poor circulation. There's so many things that we could suffer with when we don't move. And our body is made for moving, correct? Not for us to be,
That is
stagnant at one position. All right. Okay, that's really good advice, Eva. I want to say a special welcome to all our guests on tonight. If it is your first time here, please let us know where you're tuning from and let us know who you are. If you have any questions, please put it in the chat and we can put it to Eva so she could answer all your questions today. So Eva, a sports therapist basically deal with injuries. Is that correct?
Well, it depends. It all depends as to for what you specialize in. So someone could be a sports therapist and their specialty could be teaching,
Mm-hmm.
or could do, let's say, side therapy or massage. So it's a case whereby they may not necessarily deal with the injuries, but
Mm-hmm.
somebody could actually send them to you after it's been assessed and everything, and they would tell you as to what type of massage to provide for them or what type of aftercare. So you don't always deal with injuries. It's part of it. It's a big part of it, but you
Yeah.
don't always deal with injuries.
Okay. So somebody who has any injury can be recommended to come to a sports therapist so that they could deal with the injury that they have.
Yes, so they could be recommended. And the thing about sports therapy, it's a case whereby you are able to assess the injury. And in the event that you're not too certain as to what it is, because sometimes the person might need to get an x-ray done, then you refer them. You refer them into a hospital, or if it's
Mhm.
above you, then you actually refer them to a physio, whereby they'll actually give them specialized treatment.
Awesome. So, with a sports therapy, do you only deal with the sports injury, or can somebody come to you who probably was just running and they fall, or was just walking down the stairs and they fall?
So sports therapy would have to do quite a bit with movement. So if let's say for instance a person was walking and they had a fall, then it's something whereby you would be able to assess them. Because the first thing when someone comes, whether it's an athlete or just someone from the general population, you do what is called an assessment, whereby you take their case history, the same like if you'd go to a doctor or anything, and
Mm-hmm.
also a postural assessment. So after this is done, then you'd have a better idea as to how to treat them, or if it is you need to refer them
Okay,
so
so
they can
first,
visit a sports
okay,
therapist.
right. So first of all, an assessment will be done, and then if they need to be referred out to the diagnostic department for a X-ray, that
Mm-hmm.
they they can get that done. All right.
Yeah,
Okay, well, that's very good because sometimes you have people staying with the injury for 3, 4 days and they don't go to see a doctor or somebody until they are in deep pain and they cannot move.
true.
What is your advice to people like that?
Okay, sometimes you never know what it is you're dealing with. So if you're in any type of pain, and especially if it's something that's uncommon, so I'm not talking about arthritis, little aches and pain in the knees or the wrist, but if let's say for instance, like you said, you experiencing pain in your waist or lower back, if it's
Mm-hmm,
something it is advisable that you visit a doctor or you visit a therapist. So at least you'll be able to get further information on it, as opposed to you waiting and you're told it's your kidneys, or there's some
mm-hmm.
herniated disc thing, something that could have been treated from the onset.
Okay. So, I don't know if you would come across persons who would wait the last minute to come and see a doctor or a therapist or a physiotherapist. But back in the day, we didn't have much of physiotherapists, sports therapists, um, all of those professionals, and persons would take care of the injury themselves, right? Some persons will say, "Oh, I'll just tie this and it should be better in the morning," or "I will just, like you say, put a compressor on it," and sometimes it still doesn't work. And it's because they probably have more than they think they have, to deal with,
Yeah.
that they would need a professional help. Today is Liver Day in Canada. So, all the professionals
Yeah.
out there, I would say a hearty thank you to all of them because without them, we don't know where we would be, especially persons like you in your profession, in the health profession, Eva. So, if you have any advice to persons who are very young athletes, especially around the world, what would be the best advice to keep their body intact? So if today, tomorrow they have a sprain, that it's not so painful, or
Mhm.
to keep their bones from just breaking easily, what would be your advice to them?
Okay, so I go by the mantra healthy, wholesome living. So you
Yes.
need to take care of what you have. So you might be gifted, you might be athletic, but do you eat well? What do you feed yourself on a daily basis? Do you exercise regularly, or is it only when you go on the field or on the pitch? So it's
Mm-hmm.
a case of persons who are active, even from teenagers, you advise at least 30 minutes a day of exercise. Some persons might have a hectic schedule, so you advise at least 3 days in the week you should exercise. In the event that you want to lose weight or anything of nature, then you add a bit more. So my thing would be you eat well, you sleep well, and you exercise. And it's not anything to strenuous. If it is you take a jog, if it is you do few stretches, etc. All this would constitute exercise. So you just give it a try. And there's lots of videos on YouTube, and you just follow along, even though it's aerobics or anything of the nature. There's Zumba now, there's classes whereby persons find these things more interesting. You just sign up for, and you could do it online as well, and just keep active. That's
Okay.
my take on it. Yes.
That's right. That's right. Because our bodies were made for movement, not for it just to be stagnant. With the pandemic, a lot of persons lose their job and they feel sad and they feel like, okay, what I will do today is just get up, probably not even eat or drink, and just sit down on the
Mm,
couch, watch TV, Netflix, episode to episode, not walking around. I mean, even in the house, that they could walk around, go up the stairs a few times if they have stairs at their home, and other stuff. But you find that because the mental state is not there anymore, they feel all that burden on them. They feel like they cannot do anything else but just get up, watch TV all day. You know, I know you said that the best thing to do is for us to move, but is there anything
mhm.
else that they can do to help them?
In a
Yeah.
case like, based on what you just described, that person could be depressed, especially if they would have lost their job or reduced hours. So it could be something that is stressful, and exercise helps. Sometimes you may not even want to exercise, but you could meditate. Just sit still, listen to your breathing. Have some breathing exercises, and that in itself could actually help you out. Once it is you feel brave enough, just walking outside in the fresh air. We take it for granted, but this actually helps. And once it is you start moving, I believe all the rest would fall in line. But the first step is to actually make a move and follow through. Some persons may need, how should I say that, professional help, especially if
Mm-hmm.
it is you, etc. Because staying in the house may not necessarily but be the best thing for you, especially if it is you're not intrinsically motivated. Get professional help, whether it be from a spiritual advisor, a friend. Have someone that you could speak to, as opposed to just keeping all of that in, because this would actually help, as opposed to putting all that strain and worry on your body.
On your body. And another thing we don't notice that when we worry, we actually is detrimental to our body. We don't realize that
Sure.
it's being such a strain on the body when we worry. I know for sure, even excessive exercise is a strain on the body, but like you said earlier, if you can move at least 30 minutes a day, it'll be better for us and we'll have less pain when we grow older, right?
Yes, hopefully. Some
All
pain is
right.
avoidable, but at least you'd be helping the cause.
Be helping the cause. And with the younger ones that are listening, I'm hoping that they take this to heart because I have a 10-year-old who was super, super active when she was 5 and 6, and now she becomes 10, is like, I don't want to walk, I don't want to do this, and I don't want to do that. All they want to do is play video games all day. And you know what would be your advice? I know you said you're just a sport therapist, but what would be your advice to parents who allow their children to just be on the tablet or on the phone for more than 3 or 4 hours a day, and they don't know how detrimental that is to the children? What would be your advice to them?
Okay, so what I would advise you as a parent is to be creative. I have a 4-year-old nephew, a 7-year-old, and a 10-year-old nephew. And there have been times that I would have all three of them under my care. And what I did do, the first thing, I think I mentioned earlier that I was a table tennis coach. So
Yes.
I table built for me a table tennis board and
Mm-hmm.
some them how to play. I also taught them how to skip, even though they were boys. So it's
Mm-hmm.
something I taught them how to play hopscotch. You know when you have the chalk and
Yes.
you road. So
One
there
road.
are a few things you could actually do. The thing about it is to make it exciting. So
Yes.
don't just go for a walk or let's go for a walk, but let's go for a
Mm-hmm.
walk and sometimes actually have a race with them.
That's right.
Challenge things of that nature. So if it is, or have a reward system, if it is they actually follow through with whatever the activity is, you reward them. And, that would have them interested.
All right. Great, great, great response there, Eva, because I'm sure I'm probably not the only parent struggling with that kind of issue, having the children to get off, their devices and do some chores around the house, or even, you know, um, go for a walk, like you said. It is so important for their brain function as well, because being on a tablet every day for 4 or 5 hours is really not good for them. So exercise would be a very, very good activity for them to do. And like you said, we must make it very exciting so that they could participate and they could have fun while doing the exercise. I remember as children when rain falling, like right now, the whole day today was rain. We used to go in the puddles and play in the puddles
Yeah,
because we didn't have devices before, and all of a sudden, I mean, we used to keep active, and now it's so difficult to have children to be active now.
I
So
think
I really
for them. So bear in mind that if they see you doing it, chances are they'd be more
they
inclined
will
to
do
do
it
it.
as well.
Especially,
Monkey see, monkey do, right?
yeah, especially with the preteens. If it is you add music to it, so you want them to exercise, don't just make them do jumping jacks or squats or lunges. Put a bit of music. Ask them what's their favorite song, or make them choose a song and you choose a song. And
Yes.
by the end of it, like let's say 4 or 5 songs, you already have 15 minutes to half an hour into exercise. So
Awesome. Awesome.
yes.
Yeah, I remember earlier when we start, you said that you do work with the elderly um, from time to time. Can you tell us a little bit of how that is for you and what experience you've had with them?
Okay, so some persons, especially within my community, they may not be able to visit the doctor as often as they should. So in terms of their vitals, I assist them. So and some of them are afraid of needles. So to check their blood sugar, they would have an issue doing it on their own. So their blood sugar, their blood pressure, I'd assist with that. Also, in terms of meal preparations, so some of them they would be working the entire morning, and you'd ask them, have you had anything to eat? Have you had breakfast? They'd say, just a cup of coffee or a cup of tea, and it would be midday, and they wouldn't have breakfast. So just to help them with meal preparations, whether it be just a smoothie or, porridge or anything of the sort. I give them ideas as to what it is they can have.
Mm-hmm.
And if they're experiencing any pain or discomfort, then what I tend to do is to actually rub the area for you because the elderly, in my experience, if it is they have pain and you do not touch them, you could tell them exercise or lift up the arm or the leg, but that's not enough. If it is
Mm-hmm.
you do not rub them, then they wouldn't consider that you've treated them. So sometimes I just tend to massage the area for them. And that in itself, they would say that, it provides some form of relief. So that's what I would do for them. Yeah.
Awesome. That's amazing because we see a lot of elderly staying in their home by themselves because they obviously children have gone to they have their own families and the elderlies are at home by themselves. So that is a good thing that you're doing, visiting them and letting them know that you're around and you're able to help them with their meals and whatever
Yes,
else that they need, especially if they're suffering with pain. I know of some persons that would be in the house by themselves, and they go to prepare a meal for themselves, but they end up not able to do it because they had a fall, or
yes.
and then there's nobody else in the house to help them. So I guess this is very, very good that you're able to help the community, especially the elderly, um, to do one or two things with them. And with the elderly, I know for sure they probably not as fast as us now, and are able to move like us. But what form of exercise would you advise for them to do, like when you go to their houses and they have the pain and they have some discomfort?
Okay, so it all depends as to their age and their
Hmm.
mobility. Once it
Yeah.
is a person who sometimes I just demonstrate something and I'd ask them to just do as I do. So simple things like raising your hand, bringing it down, trying to
Yeah.
touch your toes,
Yeah.
touch your knees. And once it is you could touch your knees, try touching your toes. Try
Okay.
turning on one side and turning on the other side. Can you actually still stand up on one leg? So things of that nature.
Mhm.
And you've done it quite a few times, you realize that it actually helps with their balance. It actually helps with their movement. I know you mentioned that some of them aren't as fast, but they actually get the energy from it because just by stretching, you actually get and once it's relaxed, you're able to use it better.
Okay. All right,
Yeah.
Eva. That is such great information you're giving us here today. And I really appreciate you coming on and letting us know about those things that we can do to help our mobility, whether we are young or we are up in age. Um, there's one question I wanted to ask regarding somebody who have had a stroke.
Mm-hmm.
That person is not mobile as they used to be.
Mm-hmm.
Probably speech is a little bit slow. And what form of, well, with that kind of, have you experienced that before? And with that kind of experience, what form of assistance have you given that person?
Okay,
If you
so I
have
have
come
a
across anyone.
situation in terms of stroke rehabilitation and experience that sometimes they're not able to lift up a limb or raise a hand or they're experiencing paralysis on one side of the body. So
Mhm,
you start with the good side and you just do simple things like range of motion, whereby you ask them to raise their hand, face it down, or you provide a bit of resistance to ask them to do it, whereby you actually build strength. And also even the side whereby they can't move it, you actually go ahead and do this.
mhm,
So you raise their hand for them and you do it a few times. So if it is you're asking them to do it 15 times, you go ahead and do it 15 times for them. So hopefully what will happen is that the muscles would actually remember how to do it with the systems of the brain that is. And eventually once it is, you continue doing it after a while that then they may mm, to experience, mobility of whichever joint it is or whichever limb it is that they will be able to.
okay. And it is so hard when you see somebody already had a stroke. Um, with their mobility is kind of stagnant, it's not as sharp as it used to be. And I guess through the years, if they continue doing that form of exercise, whatever form of exercise that they need to do to improve their motion, I guess that will improve their body, correct?
Yes, so any little help. The thing about it is when someone will have experienced a stroke, sometimes it's mild, sometimes it's an aggressive one. So if it's aggressive, the same way the stroke is aggressive, the treatment has to be aggressive, whereby in terms of maybe just every other day you do exercise, maybe every day, morning and night, you do the same range of motion with them. You put a bit of resistance whereby, you put pressure on the limb and you still ask them to raise it, things of that nature. You introduce maybe weights to the individual. So whichever side they're able to move, you have to keep this side strong. And the side that they're not able to move, then you need to help them so that, they be able to regain mobility.
Okay. So basically, mobility is important when it comes to our bodies, especially if
Definitely,
you've had a stroke, you know.
definitely.
Okay. It is such a pleasure to have you here telling us about these ways that we can improve our pain, whether it's knee or injury. Eva, what is your most, I would say, difficult situation that you have come across as a sports therapist? If you wanted
I'm
to share with us.
so I wouldn't say difficult, but I'd say
Mhm.
challenging. So
Challenging, yes.
of my degree, as soon as I finished, I had to do some volunteering. So I did some volunteering in England, but it was for a professional football club, right? So that club would have been Crystal Palace, the women's team,
Mm-hmm.
and it was a case whereby everything was sent my way. So it could have been a tear, it could have been a broken leg, everything. So it's a combination of you, first and foremost, dealing with 15, 15 to 20 footballers. You have to provide care before they go on the pitch. So that would include massage. If there's any injury, you would have to assess it. And you had to do it in a quick pace. Maybe you just had under a minute per person to assess the injury, right? And provide a massage to whichever area. So imagine you have like 50, how many of those? And in addition to that, if there's any injury on the field during play, then you would have to run with your physio bag. You'd have to run on the field, deal with run back, and sometimes as soon as you go back, you'd be called back again, a whistle would blow. So I think dealing with more than one person is one thing when you have one person in front of you, but when you have 15 to 20 people that you have to treat, you have to assess. And to be honest, sometimes you may not be familiar with the injury. So somebody might have like a tear in the shoulder, or you may not be too certain as to how to deal with it. So you just try to treat it as best as possible. Maybe just tape it
Yeah.
and research. So the next, then what you do after you've received more information, then you'll be better able to deal with it. So you experienced quite a bit of this as well. So the challenge would be dealing with, let's say, 15 to 20 people in a short space of time, and just have that consistency throughout the game. Yes.
So, in other words, sports therapists must be able to have that super mobility as well for them to help able to help others with injuries and immobility, right?
Yes, so you have to be fit yourself in order to actually listen. Because you have to be lifting up somebody's leg or assisting them, putting the
Yeah.
leg in a certain position to manipulate and things of that nature. So you need to have that strength for yourself. So you have to take care of yourself in order to be able to take care of athletes or the general population.
Right, right. Wow. It's such amazing. I mean, well, at the clinic I work with anybody who has an injury, we have to refer them to a massage therapist or a physiotherapist or a chiropractor. And it is a long time for everything here. That was a culture shock for me when I came here. And if a sports therapist is needed, obviously you have to be referred to that sports therapist. And again, for you to see a doctor, you must be, first you must have a family doctor. If you do not have a family doctor, you have to be on a list for at least 2 to 3 years.
Mm.
And in the meantime, you can see a doctor, but you might not see a doctor well, the doctor that you're seeing is not your family doctor, right?
Mm-hmm.
So if somebody goes to a walking clinic, they have lots of walking clinics here, and they
Yeah.
would need a referral. They have to be sent to the specialist to get whatever they need done. So the system here is okay, but it's kind of was a culture shock for me, right? So if somebody
Yeah.
is having an injury and they could go straight to a physiotherapist or a sports therapist, I would say that that is amazing here, because sometimes you always have
Well,
to need a referral. Sorry, I
it
didn't
all
get that.
depends
You
because
got
you.
cut off.
Okay, can you hear me?
I could hear you now. Yes, go ahead.
So I'm saying it all depends because if it is you have to go through the general public health system, then you'd still have to visit a doctor,
Yes,
and sometimes you'd have to wait a couple of weeks to see a physio. So if it is you go to a private one, then surely the wait would be a lesser time frame. However, the thing about it is that it would be best if, in addition to visiting a physio or sports therapist, whatever it is, that you always find out as to what can you do at home. So
yes,
sometimes you do it one week, you go to physio, and then you have to wait another week to do it. However, for you to recover from any injury is a case whereby you need to exercise daily. So always find out what it is you can do at home, what exercises, etc. And usually they prescribe exercises. So at the end of the day, you'd be knowledgeable and you would actually be assistant to hasten the improvement of the injury or the
that's
treatment that
correct.
is.
Well, that's amazing information, Eva, because like I was saying earlier, if somebody going down the stairs and they just fall, they think that they sprain an ankle or they break something and they don't know. It's like what they can do at home, would be important until they see that specialist that they need to see. Um, Sometimes I get a call at the clinic, persons are saying, "Oh, I've had this for since 10 days now." And
Hmm.
I've been trying to put it on myself or for myself or on my own, and you wondered why. Why did I go to the emergency room? At the emergency room, you're able to get an x-ray right away. You're able to be assessed right away, but lots of persons take it on their own to do self, you know, self-help. They're trying to help themselves and they think, all right, okay, it's not hurting that much. I could do this, or I could bear the pain until it becomes worse. And sometimes it becomes worse, and then you are dealing with probably a broken rib or something. So um, I'm happy that you're able to share that information with us today. Um, and I would ask, what is the easiest thing that you've ever done, or I would say, what is the most important part of your day when you go on the job as a physiotherapist?
Okay. So that's two questions. So I'll see if it is I could answer to
Yeah.
both. So in terms of the easiest, especially when I'm dealing with teams or a group of athletes, what I find is that once I provide tape for them, so I'm not sure if you've ever seen it. It's called kinesiology tape. So it's the colored
Yeah.
tape, and some could be put on the knee, things of that
Yes.
nature. Surprised
Yeah.
as to the amount of support they would get with it, and it would
Yeah.
actually help boost confidence, and it looks pretty cool once you see the colored tape, like all
Yeah.
different styles and stuff. So
Yeah.
in terms of the easiest thing, let's say for instance, if someone has a sprain, so the same way you could put a bandage, you could actually put the tape to actually mimic the bandage, and it would
Mm-hmm.
provide support. So things of that nature I love doing, and I consider the easiest. And in terms of, let's say, when someone comes to me and I'd say the best part is, let's say, after treating them, and they
Yes.
would say that you receive instantaneous relief. So I love what I do. So if I provide a massage, or let's say soak somebody's feet or anything of the nature, once they leave and they said that, they're not in as much pain, or the pain is completely gone, even though
Yes.
sometimes those things provide temporary relief, but it
Exactly.
does boost your confidence as a therapist, and it actually it builds trust, whereby they would be more than willing to come back. Yes.
That's right. That's amazing. You'd wonder, oh, I just put a little band-aid on the person's wrist or the person's arm or leg or knee or whatever that's hurting them. But just caring for them at the time that they need help, that is incredible. And the like and trust that you're talking about, they will come back and they'll know who to ask for, when they do come back, with another injury, or they will bring somebody else, with an injury, and they'll say, oh, she's the one who treated me. I think I should go to her, or I should wait for her. So that is so important. Customer satisfaction is one of the most important things when it comes to clientele, and how um, satisfied they are when they have the injury and they're able to get rid of their pain, or they don't have so much pain when they're leaving. So that is very, very important. Sometimes you hear people say that, oh, I've gone to the health center and I waited how many hours and nobody saw me, or I didn't get any treatment, or I got treatment but it didn't do anything for me. You don't want to hear these things when, in the health sector,
That's
especially when you see persons come to the clinic and they have that kind of response. So that's why I ask you, what is the best part of your day when you, as a physiotherapist? As a physiotherapist, what you like doing. But like you said, it's something that you like doing and you enjoy doing. So this is the highlight of your day, when the person leave and they leave and they're not in so much pain like when they came in. So our time is almost up. Um, do you want to leave a special tip for the day, for a special health tip for the day?
okay.
We
So
have some audience here who probably would want to. I'm not seeing any questions or comments in the box, so I'm hoping that everybody is excited about what we're talking about tonight. Um, Having less pain and what you can do to reduce your pain when you do get pain in your knees or your joints. So Eva, if you want to leave any last health tip for the day, let us know what it is, and then we can close. I'm sure everybody is waiting for the health tip of the day.
okay, so that tip would be, in terms of pain or anything, ice. So if it's something
I,
that just started, you just put ice on it. If it is
yeah,
you experience a sprain, or you're not able to go get an X-ray done or anything,
yeah,
just ice. Ensure that you rest with the ice. Just
yeah.
like there's acronym RISE, so it stands for its suppression, elevation. So I would advise, especially when you get those ticklish injuries, or
Yeah,
those constant aches and pains, whether you're an athlete or anything of this nature, you're suffering
yes.
from brain for a few years, just put ice on it. Ice is free. You ensure that you want something, you keep it, just don't keep it for too long. It's not advised. So at least 10 minutes on, then 10 minutes off, 10 minutes on again, 10 minutes off,
Mhm.
and so you could do it like that to prevent further injury, and don't put the ice directly in your skin. So I'd advise this. And in a nutshell, just ensure that you keep on moving. Whether it is you're down, whether it is you have a hectic day at work. Some persons, depending on their job, they sit down, or they might have a headset. Even though you have a headset, it has a cord or something attached to it. You could
Mhm.
stand up where you could just walk. As far as it could take you, just walk around, move around. Just
All
don't
right.
sit for, take a break. That's my advice.
Okay. Well, thank you so much, Eva. I know the internet has been a little bit troubled today because I have a lot of rain. We have a lot of rain here in Nova Scotia today, and the weather is not so good. But I want to thank you so much for sharing with us all that beautiful information about how we can not really stop our pain, but bear our pain until we see a specialist, until we able to see a doctor for our pain, whether it's our knee injury or our massage for our back or our whatever pain that we having right now. So we have 5 persons on. I can see they have 5 persons on. If you have any questions, any comments, please let us know. Um, if you have any questions for Eva, she's here to answer your questions this evening. I cannot see any questions in the, but I want to thank Eva for taking her time. I know you have a busy schedule, and today is Monday night, and it's just the beginning of the week for you. So you probably have a big and hectic day ahead of you tomorrow. But I really want to thank you, Eva, for taking time to share with us this information, what a sport therapist does, and what you have to deal with, you know, as a sports therapist, and what we can help, how we can ourselves when we have injury. Everything you must ice. And she said, don't leave it for too long, right, Eva?
That is correct. The earlier you treat it, the sooner it is you recover from it.
Um, any last words, Eva? What else can you leave with us?
Okay. What I would advise is healthy, wholesome living. So you take care of the mental, you take care of the physical as well. So both
That's
of
right.
them important. Don't let
Yeah,
the stress overwhelm you. You deal with it. You speak to somebody, even though it's a professional. And these times it could be trying, but once it is you're not in it alone, it becomes more bearable. And exercise is important in everything. Just keep on moving. That's what I'd say.
that's right. Thank you, thank you, thank you, Eva. Thank you so, so much. And we will have you on the show again because this is great information. And let us know, share with us where you have your practice and where people can get in touch with you if they need help, if they need a massage, if they need help with anything that they're going through, the injuries and stuff like that. Let them know where you are.
Okay, so quite mobile in the sense that I visit gyms and clubs and even homes because
Mm-hmm.
sometimes they want to be comfortable where it is they're treated, and I provide that service as well. Also, I practice in Castries, so if anyone would like further information, you could actually reach me on 715-3855, or you could reach out on Facebook. My name is Eva Stanislaus, and we could chat from there.
Awesome. Amazing. Well, Eva, thank you again. And we hope that tomorrow is not too hectic for you. And you could put lots of smiles on other people's faces when they leave tomorrow from your clinic. All right?
Hopefully, yes.
All right. Thank you so much, Eva. And our special guest this evening was Eva Stanislaus, a sports therapist from St. Lucia. We want to thank her again for taking time from her busy schedule to be with us on Help Tips with Avril. She's left us a help tip. If you are suffering with any pain, she advised that you put ice on it. So you'd ice everything and don't leave the ice on for too long. So this evening, we want to say thank you again for all our audience, all those who was listening with us tonight. We want to thank you. And we are here every Wednesday from 6 o'clock Eastern Caribbean time, 7 o'clock Atlantic time. Today was a special edition from Eva Stanislaus. She is a sports therapist in St. Lucia, and if you want to get in contact with her, she is on Facebook as Eva Stanislaus. So you can contact her for any other information that you need. So once again, we want to say thank you, everyone. And visit us again on Wednesday. We will have our normal Wednesday health tips with Avril. And we want to say thank you for your support and thank you for your love. Good evening.
Good evening.
Night, Eva. Night.